This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What is proteolytic processing in collagen synthesis? Answer: Proteolytic processing is the cleavage of disulfide-rich terminal regions of procollagen, which leads to the formation of insoluble tropocollagen. Question: What is the role of assembly and alignment in collagen synthesis? Answer: Assembly and alignment is the process where collagen assembles in fibrils and aligns for cross-linking. Question: What is cross-linking in collagen synthesis? Answer: Cross-linking is the process of reinforcement of staggered tropocollagen molecules by covalent lysine-hydroxylysine cross-linkage to make collagen fibrils. Cross-linking of collagen increase with age. Question: What is Menx disease? Answer: Menx disease is a genetic disorder caused by problems with cross-linking in collagen synthesis. It is characterized by defects in the metabolism of copper, leading to abnormal hair, poor growth, and neurological problems. Question: What is the function of collagen in the body? Answer: Collagen is the most abundant protein in the body and plays a critical role in providing structure and strength to various tissues such as skin, tendons, ligaments, cartilage, and bone. Question: How does cross-linking of collagen affect the body? Answer: Cross-linking of collagen increases with age and leads to increased stiffness and decreased flexibility in connective tissues. This can contribute to the development of conditions such as osteoarthritis and other age-related degenerative conditions. Question: Can cross-linking affect the skin? Answer: Yes, cross-linking of collagen can affect the skin as well. As we age, the amount of collagen in our skin decreases, and the existing collagen fibers become cross-linked. This leads to wrinkles and loss of elasticity in the skin. Question: Are there any treatments for Menx disease? Answer: Menx disease is a rare genetic disorder and currently there is no cure. Treatment options include copper replacement therapy and supportive care to manage symptoms such as seizures and developmental delays. Question: Is there a way to prevent cross-linking in collagen? Answer: While cross-linking of collagen is a natural process that occurs as we age, certain lifestyle changes such as maintaining a healthy diet, avoiding smoking, and protecting the skin from UV damage may help slow down the process. Additionally, some studies have suggested that certain antioxidants such as vitamin C may help prevent cross-linking. Question: How does collagen synthesis occur in the body? Answer: Collagen synthesis occurs through a process called post-translational modification. This process involves the formation of procollagen in the endoplasmic reticulum, and then it is transported to the Golgi apparatus where it is modified and packaged. The procollagen molecules are then transported to the extracellular space where they are assembled into fibrils and cross-linked to form mature collagen fibers. Question: What are the different types of collagen? Answer: There are at least 28 different types of collagen, but the most common types found in the human body are type I, 2, and 3. Type I collagen is the most abundant and is found in skin, tendons, ligaments, and bone. Type 2 collagen is found in cartilage, and type 3 collagen is found in skin, muscle, and blood vessels. Question: Can collagen levels be increased in the body? Answer: Yes, collagen levels can be increased in the body through dietary changes, supplements, and certain skincare products. Consuming foods high in collagen such as bone broth and certain fish and meats can help increase collagen levels. Additionally, supplements such as hydrolyzed collagen and creams containing retinoids or vitamin C can also help increase collagen levels in the skin. Question: What are the potential side effects of taking collagen supplements? Answer: Collagen supplements are considered safe for most people, but some may experience side effects such as stomach discomfort, bloating, and allergic reactions. It is always recommended to speak with a healthcare professional before starting any new supplement regimen. Question: What is the role of lysyl oxidase in collagen cross-linking? Answer: Lysyl oxidase is an enzyme that catalyzes the formation of cross-links between lysine and hydroxylysine residues in collagen fibers. This process is known as cross-linking. This enzyme is essential for the formation of stable collagen fibers, and a deficiency in lysyl oxidase can lead to Menx disease and other connective tissue disorders.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.